Acute leukemia, what is it? Well, back to the stem cells. The stem cells grow up into the different kinds of cells, just like I showed you in the bone marrow.
Okay.
They go through different stages, just like growing up as a child. What happens with these is, along the way, they stop growing up. They stop in a very young stage. Now, those cells grow very fast. They come from the bone marrow, where you're making things. Now, the stuff in the bone marrow, its job is to go in the peripheral blood and circulate around. So that's why it's leukemia, because it's usually in the peripheral blood. It's acute because acute leukemia meant more rapidly aggressive. And that's how they termed it early on. So acute leukemia are these young cells. And we didn't know that for a lot of years, but we do now. Again, these cells don't look like what they will be one day. So I have to do a whole set of studies on it to figure out what it will be. And the reason it's important is, say it was going to grow up to be a lymphocyte one day, and it's not mature enough to be a lymphoma. That is one kind of chemotherapy. Where if it was going to grow up to be a granulocyte, it doesn't get anywhere near that, that's a completely different kind of chemotherapy. So it doesn't grow up into a normal functioning cell, and it will push out the normal stuff. That area that was all different in the bone marrow, it all becomes packed with one thing. It's just these they're called blasts. Okay, and you can also have them form tumors in other places as well. Now, here again is the same picture, normally all different. Here is
different cell types on that one that you showed. This is the normal. There's many cells in the body, right? In the bone marrow.
And this is the same picture as before. It's just a reminder. And this is acute leukemia. See how they're all the same?
Yeah.
And normal stuff is just about totally gone. Here's one granulocyte, maybe another, but everything else is just totally replaced it. Now, if you've heard about bone marrow transplants, the concept there is normally your body cannot take more than a certain amount of poison. So let's say that your cancer does not respond to the amount of poison that's safe for you to have.
It's the poison is the chemotherapy, right?
Exactly. It's chemotherapy. Okay. So say your cancer doesn't respond to that, or in general, that type of cancer doesn't respond. The trick here is certain areas in your body are more susceptible to the chemotherapy than others. Okay. Your GI tract, which is why you'll throw up and maybe bleed, and your skin, and also your bone marrow. Okay, so and that's because they're growing so fast all the time. So they take up more of the chemotherapy or the poison. Yeah. All right. It's essential that you have bone marrow, because without bone marrow, you have no red cells, you have no ability to clot, and you have no ability to fight infections. So let's say we gave you so much poison that you have no more bone marrow, or there's nothing in there. Yeah. Well, now the transplant is we will either take cells that we harvested from you before we gave you the chemotherapy, or we'll take it from someone else, like your brother, sister, or someone who is closely related and matches your blood. Okay. There are a lot of proteins we look for that are different. And we can give you back that stuff in your arm. We don't have to go right into the marrow necessarily. And those cells will circulate, and there's some of them that will home in on the bone marrow because they know that's where they're supposed to go. And they start regrowing what normally is there. So at first, for the first week or two, you have no ability to clot. You have no ability to fight infections. So they keep the person very isolated and make sure that they can't get infected, although it can happen. And then as the bone marrow grows back, you have your ability to make blood cells, platelets, and your white cells again to fight infection. There are other issues that you need to deal with to try to maintain your bone marrow at that point, because there are other complications from that. But that's the concept behind transplant.
Okay. Now that's pretty interesting. I think that they give these cells in the arm, like in a vein in the arm, and then they go to the bone marrow, as you were saying.
Yeah. Yeah, they know what they're doing.
Yeah.
So that concludes the lecture for now, unless you have a question or two.
Well, I don't have any particular question. I think we have discussed several things, and I think this was an excellent overview of leukemia, lymphoma, stem cells, and cancer, and some of the types of treatment, the effects they cause, such as hair loss. They cause vomiting, blood in the intestines, and I definitely really appreciate this, Dr. Block. So,
My
it's been
pleasure.
a pleasure speaking with you today.
You as well.
All right. Take care, sir.
You too.